Hi everyone, I'm Melissa from London Slimming Clinic. I'm going to show you how to correctly use the Mounjaro pen. Mounjaro is a once-weekly injection which contains Tirzepatide and is prescribed for weight loss. Mounjaro is delivered in chilled and insulated packaging to maintain the correct temperature during transport. Each pack of Mounjaro contains an instruction leaflet, patient information leaflet which you should read before first use, and the Mounjaro pen itself. Compatible needles will also be supplied. The Mounjaro pen contains 4 fixed doses, 1 dose taken weekly. Therefore, 1 needle is to be used each week. Check the expiry date to ensure the medication is within date. Remove the pen cap to check the liquid. Mounjaro should be colourless to slightly yellow. It's important to note that the medication is contained here in the pen and not in the needles. Next, you'll need to attach a new needle. Wipe the red inner seal of the pen with a swab. Pull off the paper tab, then push the cap needle straight onto the pen and twist the pen needle on until it's tight. Remember to always use a new needle every time you take the medication to help prevent infections and block needles. Each time before you use the pen, you'll need to prime it to check that the pen is functioning correctly. Pull off the outer needle shield and keep it. This will be reused later when removing the needle. Pull off the inner needle shield and discard it. Slowly turn the dose knob until you hear 2 clicks, and the extended line is shown in the dose window. This is the prime position. Hold your pen with the needle pointing up. Now push the dose knob in until it stops. The 0 must be shown in the dose window. You should see a drop of liquid on the tip of the needle. If there is no liquid, then repeat the step. To select the dose, turn the dose knob until it stops and the 1 icon is shown in the dose window. The 1 icon is equal to a full dose you are taking. In this case, it's 2.5 milligrams. Mounjaro can be injected into either the abdomen, the upper thigh, or the upper arm. Do change and mix up your injection sites each week to allow the skin to heal and avoid any potential soreness or bruising. Insert the needle at a 90-degree angle into the skin. Press and hold down the dose button either with your finger or your thumb, and the dose counter returns to 0. Then count to 6 and remove the needle. You may see a drop of liquid at the end of the needle, and that is normal and nothing to be concerned about. Put the outer needle cap, which you saved earlier, back on the needle and unscrew it from the pen. Dispose of needle in the sharps container. Do not put these in your normal household waste bin. Once you start using the pen, you'll notice that a plunger begins to appear. This is normal and it just indicates how much liquid is remaining. Once the plunger reaches the end, the pen is empty and you've used up all 4 doses. Put the cap back onto the pen and store it away until the next use. The used pen can either be stored in the refrigerator 2 to 8 degrees or unrefrigerated for up to 30 days as long as the temperature does not go above 30 degrees centigrade. If kept unrefrigerated, the pens must be discarded after 30 days. And that is it. That's all there is to it. If you have any questions or concerns, don't hesitate to reach out to us at the London Slimming Clinic.